I think baby-friendly is just a concept of having the best possible environment for mother and baby when a laboring woman comes into the hospital, and then following that delivery too.
The hospital and the health department have really partnered together to offer these trainings and to make sure that the health departments and the hospital are giving the same messages. We want everyone saying the same things to the moms at all times.
We have a responsibility to help our community become healthier and baby-friendly. Clearly, the evidence supports the idea that exclusive breastfeeding is the way to get a healthier population.
Everybody who's a pediatrician has had some experience in their training with breastfeeding, but a lot of times it's very variable, and in my opinion, it's just not enough.
There's so many things that help a mom and baby with breastfeeding that formula cannot do. And because it is natural, it is safe, it's never been recalled, it's healthy for mom, it's healthy for baby, most definitely.
We hope that long-term outcomes are proven. We're hoping that we have healthier babies, healthier kids as they grow up, and there's a lot of literature that says if we start when they're babies that they'll be healthier adults as well.
The purpose of Baby Friendly is to really make breastfeeding easier for both the mom and the baby.
I could understand now how so many moms would give up on breastfeeding because it's so hard at first, but the nurses were very supportive and they'd help me with the babies, they'd bring them to me. They'd always encourage me and just tell me how good a job I was doing.
They come in with kind of a preconceived notion of what their labor and delivery is going to be like, and just educating them about why we do things like putting the baby skin to skin right after delivery, allowing them to have time with just them and the baby before all their family members flood in.
So the more educated healthcare providers are, the more educated they can make their patients, and again, the easier it is for moms to breastfeed.
You have to retrain, you have to reteach, you have to show the community what you're doing, and you have to explain why.
Now that Baby Friendly is becoming more of a something that we're all hoping to achieve here in the community, then I am trying to work more on just finding those resources, referring the patients to the health department, the lactation consultants, even sometimes back to some of the lactation nurses at the hospital, anybody that we need to get on board with more support. And just knowing that with Baby Friendly, I've been able to meet a lot of proponents of breastfeeding, and so it's not just me in clinic and with a busy schedule trying to help facilitate this anymore. I have a team behind me.
Well, it's a team effort. If we were just doing it all by ourselves, it wouldn't be effective. We have to have the prenatal, the perinatal, which is our part, and it's only a 24-hour period right now, and then post-op, it's part of the pediatricians, the family practice physicians who take care of the moms and the babies. Many pieces to the puzzle. We're just a small piece.
So they have signs on the walls about the 10 steps of Baby Friendly. They have the information in the waiting area about the finish line and going for the gold and that golden hour. They have table tents in the cafeteria. So those table tents, again, explain the 10 steps and the golden hour and why this is so important for mom and baby. Because we want everyone in the hospital to know about this. We want it to be a climate where breastfeeding is valued and seen as important for both baby and mom.
I would choose to go to KSB again just because they are baby friendly, and the nurses and doctors were all very supportive of my decisions to breastfeed.
Baby friendly is just going to be the norm. I mean, they're going to see more and more breastfeeding rates increase around the state. More hospitals are going to want to become involved, and people are going to think, wow, this little rural area can do it. We can do it. What's holding us back?